Hey guys, how are you? Welcome back to my channel. This is Reading Addict. In this video, I want to talk about the healthcare system in Canada. Previously, I had the understanding that Canadian healthcare system is one of the best of the world. Before coming to Canada, this was my opinion, and this was the opinion in regard to so many developed countries. I I just thought that things would be better and there would be more professionals, more specialists, more advanced facilities in healthcare industry, and the experience would be more smooth whenever one interacts with the healthcare industry. So far, I have been living in Canada for almost 3 years. So far, what I have noticed and observed that, and I haven't had face to face interaction or in person experience with the healthcare system, like visiting a hospital or visiting a pharmacy. So I would say that in my experience, what I have observed, that what people are saying that the healthcare is collapsing, it is melting down. And why they are saying that, what are the reasons for that? The first reason is that there are number of factors, and based on that people say that it is crashing. The first reason is that people are waiting for months and months for their treatment. So what happens, suppose if someone has to go through a surgery and then doctor gives an appointment, and that waiting period is almost 12 to 18 months long. So no matter what kind of surgery you have, you will have to wait for your turn, and that wait could be within the range of 1 years to 2 year. So in that time period, anything can happen. On the one hand, you are waiting and your condition is worsening, but you have to wait. And this is the reason that the healthcare system is not taking care of the Canadians, because whenever Canadians need the health services, it is not there. So because of that, many people die waiting for their turn. So you can imagine the frustration that Canadians have in regard to this waiting list. Secondly, the second reason is there is a massive shortage or a massive gap between the number of patients and the ratio of doctors. I read that in the last 20 years the government has cut vacancies in order to minimize the cost of healthcare industry, but now it is backfiring. Now there are less doctors but there are more patients. Because of the immigration policy of Canada, there are more people coming in Canada, but the vacancies, or the doctors or nurses, they are still to catch up with the rising demands of these new patients. So that is the second reason, I would say, that which makes Canadian healthcare industry not up to the mark. The third reason is there is a law which the Ford government passed in 2019, I believe, or I'm not sure which year it was passed, but where there was a cap in the wage of nurses or healthcare professional. So that means it is a disincentive for these people to join the healthcare industry. So that is why some of the people, some of the healthcare professionals are going to different provinces to get rid of this clause in the law where they can earn higher wages comparatively. And next reason is, so sometimes whenever there is an emergency, whenever there are more numbers of people visiting the hospitals. So recently, in I apologize, recently in the case of children, when suddenly they had to rush to the emergency ward. There they had to wait for hours and hours. So and children's condition were getting worsened, but there was no relief, there was no help, and they were suffering. Even the doctors, nurses, the healthcare people, they felt pity for these children because there were limited number of beds, but they cannot accommodate all the children at the same time. Some children had to wait, but this is the problem, this is the shocking situation. Suppose if I had my children among those children in the waiting, and when my kid is in serious trouble, and if he has to wait, if he or she has to wait, then I would be pissed off badly, and I would criticize Canadian healthcare system madly. So that is the reason that the system seems crashed as of now. And I have noticed that, and this is my personal opinion, that Canadian, in terms of I don't want to mention this point, so I think that's the things that I wanted to discuss, and we will talk about some other topic in my next video. And I believe that Canadian system will get better. It is just suffering from the bureaucratic delays and administrative blunders. Otherwise Canada has funds, but it is just too conceited to use those funds.